So today is the first of a series of videos focusing on the infection chapter of the GPhC exam. The infection chapter is extremely important because it's a high weighting topic, and high weighting material can account for 60 to 70% of the GPhC pre-registration pharmacy exam. So let's run through the basics. The first and the most important thing is the fact that viral infections should not be treated with antibiotics. Secondly, samples should always be taken for culture and sensitivity testing when it is appropriate and when it can be done. Generally, a narrow spectrum antibiotic is preferred over a broad spectrum antibiotic unless there's a clear indication to use the broad spectrum antibiotic. So here we're trying to narrow down the spectrum of activity for the antibiotic to decrease the possibility of resistance. If it's difficult to identify the organism that's causing the infection, that's where you may want to use a broad spectrum antibiotic. If it could be used if a large variety of different organisms could be causing the infection, then you would want to use a broad spectrum antibiotic. The most important factor is the fact that the dose of an antibiotic could vary according to a range of different factors. This could be due to the age of the patient, the weight of the patient, either the liver function of the patient or the kidney function of the patient, so the renal function, as well as, of course, the severity of infection. If you have severe cellulitis, for example, you may want to use the highest dose, the 2-gram dose of flucloxacillin, and then that would affect, of course, the route of administration. So IV is generally used for more severe infections. There are exceptions to this rule where you could be using oral antibiotics with a high bioavailability. One of the examples of this is linezolid. So the route of administration would, of course, depend on the severity in the majority of cases. The duration also depends on the nature of infection, as well as the response shown by the patient, as well as the inflammatory markers. So we do have a large amount of evidence to show the durations that we may require for particular indications, and then we look at how the patient is responding, and this together would lead to how long you want to treat the patient for. And the most important thing is that undue prolongation of antibiotics could lead to resistance, could lead to the experience of side effects, as well as cost. So these three factors are why it's extremely important not to prolong the treatment of antibiotics. This summarizes the introduction for the infection chapter of the GPhC exam. Then we'll start going through different parts of the infection chapter.